I have been practicing applied kinesiology for 34 years. Applied kinesiology is a diagnostic system. So it helps me as a chiropractor to determine what is causing a patient's problem or your problem, and then I use different techniques that I've learned over the last 34 years to what to do to fix it. I'm also known as a diplomat of the International Board of Applied Kinesiology, which makes me an expert or a specialist in the field of applied kinesiology, and I've been teaching chiropractors applied kinesiology around the country and even overseas for the last 27 years. So what I'm going to do now is give you a demonstration of how applied kinesiology works. This works in with my chiropractic video, which hopefully you've already seen. Applied kinesiology is all about using a muscle test. The muscle will either get stronger or go weaker, and that change tells the skilled chiropractic applied kinesiologist what is wrong in the body, what is wrong with the spine. So we'll give you a little demonstration. The first thing you ask the patient is to push out against your pushing in. So I'll just show this to you. The word I use when I'm doing this is hold. So I'll ask the patient to hold and I push against them. Now this is not an absolute strength test. All I'm really feeling for is a feeling of holding my push in. So the first thing is hold. So this patient's got quite a good strength. Then I push down on this. If I push on this ear limb, she goes weak. If I push on this ear limb, she stays strong. Now that tells me there's a problem on her left ear limb. That doesn't necessarily mean where that's the pain is. I then correlate this with what I've seen in a postural analysis, but that's what I'm doing all the time as an applied kinesiologist, sometimes known as a kinesiologist, to determine what's wrong. So for instance, if you came to see me with low back pain, one of the common causes of low back pain is a problem in your sacroiliac joints, and this particular patient has a weakness on her left sacroiliac joints, and I know that because she was strong. I'll show you again. She is hold, and then I push on the right, no change. I'm pushing down on the right, no change. I push down on the left, she goes weak. That's how kinesiology works. Now, if I want to then check different spinal segments, the same deal happens. I come on here and I get on what's known as the L5, which is your last lumbar vertebra, and push from posterior to anterior on that. See what happens? Hold, no change. Okay. I come here on this side. I'm pushing from posterior to anterior on the side of the L5 vertebra. Hold, and she goes weak. So that tells me this particular patient has got a problem in her left sacroiliac joint and her right L5. You can do that all the way up your spine. Where applied kinesiology is completely unique is when it comes to the extremity joints, which is your knee, your ankles, your hips, your wrists, your elbows and your shoulders. So if we take this patient's knee, we go back to the muscle test, hold again, we've got a nice firm muscle. We can then test the muscle, the knee, by pushing it like this, hold, all right. If her knee was slightly rotated, which it often is with people, particularly what's called outward rotation or external rotation, if I rotate it more, that makes a problem worse, that makes a muscle weak. So I can use that to determine what is wrong with a knee, and that assists the muscle work, the rehabilitation work I might want to do on a knee. It's the same if we look at the ankle, all right? Same deal, pushing different ways and coming back to the muscle test, hold, and if it goes weak, that tells me that something's wrong with the ankle, and then I know the therapies I use to actually correct it. So that's how I use applied kinesiology in my practice as a chiropractor, and that's how I use it to help you get better. So whatever problem you have starts dropping away. Now, just before I finish this video, I want you to know what I believe is you're meant to be 100% well. So if you're not, there's a reason. There is, however, a journey that you've got to walk to get better. And that takes time and determination on both the practitioner's part and yours to do whatever it takes to get yourself well.